My name is Brittany McCarter, and I'm going to tell you a little bit about schizophrenia. I hope you can see that. Some of the history of schizophrenia, the concept of madness has been around for many thousands of years, and schizophrenia was classified as a distinct mental disorder by Kraepelin in 1887. There were also written documents that identify schizophrenia can be traced to the old Pharaohic Egypt as far as the second millennium before Christ. A recent study into the ancient Greek and Roman literature showed that although the general population probably had an awareness of psychotic disorders, there is no condition that could meet the modern diagnosis criteria for schizophrenia in these societies. The word schizophrenia comes from the Greek root schizo, which means split, and phaire, meaning mind, to describe the fragmented thinking of people with this disorder. The word schizophrenia is less than 100 years old. However, the disease was first identified as a discrete mental illness by Dr. M.L. Kraepelin in 1887. Symptoms of schizophrenia usually start between the ages of 16 and 30. In some rare cases, children can have schizophrenia too, but it can also occur at any age. The average arrival tends to be in the late teens to early 20s for men and the early 30s for women. It is uncommon, though, for schizophrenia to be diagnosed in a person younger than 12 or older than 40. It can be difficult, though, to diagnose schizophrenia in teens. This is because the first signs can include a change of friends, a drop in grades, sleep problems, and irritability, and that's really common in adolescent behavior. Although schizophrenia is not as common as other mental disorders, these symptoms can be very disabling. It is possible to live well with this disorder, though. These symptoms of schizophrenia include positive, negative, and disorganized or cognitive symptoms. The next slide. This is just a picture, if you can see, of the first one is of a healthy brain, and then the second one is a brain of someone that has schizophrenia. Some of the symptoms of schizophrenia include, there's 3 categories, positive, negative, and cognitive. Hallucinations or hearing voices, delusions, disorganized thinking and speech, loss of train of thought, social withdrawal, sloppiness of the dress or the hygiene, where they don't look like they really take care of themselves, or they can't. They have a loss of motivation and judgment, paranoia in some cases. In some cases it can be very severe, in some cases it's just minor. And they also have a lack of responsiveness. Some of the causes of schizophrenia, genetics is one of the big ones. Environmental factors, childhood trauma, possibly the death of a parent, being bullied or abused, maybe when you were a child, substance abuse also, and some developmental factors. Everybody always wonders what causes schizophrenia. Experts think that it's caused by several of these factors. Like I said, genes and the environmental factors is a big one that plays into schizophrenia. It's just not caused by one genetic variation, but a complex interplay of both genetics and environmental influences. Scientists also have said that the disorder can run inside family members, and it runs in the families. However, there are also many people who have schizophrenia in the family, and with this disorder that many people do not develop this disorder, so it just depends. This is what it kind of feels like in your mind and your body of when you have schizophrenia. You can see how it looks like she has 4 or 5 more bodies are coming out of her, and then this one it looks like all the hands you can see that are grabbing him and trying to pull his attention. Some of the treatment for schizophrenia, hospitalization, and depends on when you're in there, depends on how long and you have to be in there for. You can be on medication, such as antipsychotic medications. Psychotherapy is a very big one. Also, cognitive behavior therapy. Self-help groups can help you. Case managements. 24-hour crisis services, just in case you never know. Counseling. Also, drop-in centers and housing programs. If you have schizophrenia and you have trouble monitoring and just living your life, housing programs can help you, help your life and get you into somewhere that can help and everything like that. The prevalence, about 0.3 to 0.7% of people are affected by this disorder in their lifetime. In 2013, there were estimated 23.6 million cases globally. It also affects more than 21 million people around the world. It occurs approximately in 1% of the general population, but occurs in 10% of the people who have that first-degree relative with the disorder schizophrenia. Also, it seems that males are often more affected on the average, and they experience more symptoms than women would. Lastly, some of the controversies of schizophrenia. Clinicians do not base their therapeutic strategies exclusively on the diagnosis, but also the symptom predominance. Schizophrenia research design involves either stopping or delaying treatment, especially for those who have severe disorders, which may benefit from immediate treatment, but it may create a dilemma. Another controversial type of drug discontinuation research involves prolonging discontinuation on effective treatment. Some controversies concern where to focus the content, what techniques to employ, and what theories can be derived from intense psychotherapy with schizophrenia patients. So that's a little bit about schizophrenia.